The primary function of a statin drug is to decrease the amount of cholesterol in the body. When someone who already has coronary artery disease, it's believed to stabilize those plaques so that they don't rupture, and it's the rupture of a plaque or the instability of a plaque that causes a heart attack or coronary event. Some of the greatest challenges is we generally provide statin drugs as preventative, and more often than not, patients have absolutely no symptoms. So it's difficult to come to a patient and say, hey, listen, you need to take this medicine every day for the rest of your life. Another big challenge is overcoming misperceptions about these medications. Inform yourself about what those myths out there are so that you can address them, you can face them with the patient. I try to tell patients we're making an investment in your healthy future and your family's healthy future, just like you would put away $50 a month into a savings account for your kids' college. This is the same thing. You're putting away, a small pill every single day to prevent you from having problems in the future so you can be alive and healthy for your children.
Come in.
Do you remember when we talked about why it's so important to you to take that particular medication?
One thing that I remember the most is to avoid a heart attack.
Right. What we're trying to prevent in your case at your age and this time is that heart attack, heart failure, difficulties with the heart. And so these medications are very, very good at it. They work even though you don't feel them working, you can't really measure them working to protect you from having these problems.
The way I handle patients who are not taking their medications consistently, I try to get to the bottom of the reason why.
What are some other things that you might be struggling with this medication?
Well, doctor, it's a lot of medications, a lot of pills that I had to take, so at times I feel overwhelmed. I'm like, I don't want to take the pills.
You'll hear people say, the medicine doesn't do me right. The medicine doesn't make me feel well. And it's hard sometimes to exactly pinpoint what that thing is. So I try to remind everybody, every medication has an adjustment period. And sometimes it might take your body just a while on this particular medication with this particular dose to get used to it. It might be 3 months, it might be 6 months. I will tell them, sometimes it's just being patient. And if it's not getting in the way of you getting up every day, going to work, doing your housework, being with your family, then let's put up with it for a little bit. And I promise, if it doesn't go away, we're going to do something different. But the important thing is, again, that we're taking some sort of statin to keep you from having heart attacks in the future.
Remember, when we write these prescriptions, we might say once a day in the morning or once a day at night or twice a day. You can spread out your pills, kind of a balance, trying to find what's going to work the best for you.
Sometimes it's just helping them understand that there are so many tools that they can use. Let's use technology, let's use reminders, get your family in on it. Especially older patients, maybe their kids or their grandkids can help them remember to take medication. And placement, another thing. Put it by your bedside if it has to be. My medications are in the kitchen.
Remember those pill boxes we talked about? Yeah. Sometimes you can get pill boxes that have three for one day. And you can take some in the morning, some like after dinner, and then some before you go to bed. Our phones are very, very smart nowadays. No matter which type you have, you can set alarms, and then there are many, many apps. I can show you the app that I use to take my medicine.
The beautiful thing about statins today is that there's so many choices. We can rotate statins. And so if you're having a difficulty with a patient adjusting to a particular statin, you can change. And then the other part of it is doses. If dose A doesn't work, if you don't want to rotate, bring the dose down, and maybe their body will accept that medication better, and they will do much, much better with that medication.
As long as you're also watching your diet, getting a lot of exercise, that helps support the good cholesterol, which will protect your heart, and then this medication can do its job. In your case, it's just taking the pill at a certain dose that you're tolerating that's going to give you that protection.
And then the other part of this is persistence. Any questions about taking it? Let's talk about this again. I understand you're not ready today. It's very important, though, that we discuss this, so the next time you come, I'm going to bring it up again. And let's see where you are. And do some reading, talk to some people in your community. Bring in your family, and I'll talk to them and see if we can come to some place together. There's so many things you can do to get your patients on a statin. Don't just give up once they say, I'm not taking it anymore, and write statin allergy in their chart, because that's not going to serve anyone. When we have patients in the office, we bombard them with medication. So imagine you're sitting in the patient's chair, and in a 15-minute visit, you're told, number 1, you have high risk of heart attack. Number 2, you got to take this pill every single day. Number 3, come back in 3 months. Number 4, they're going to pick maybe one of those things to remember. So again, it's a lifelong process. First start with the pills, and then here's the medication, here's the reason why, then like go into other things with subsequent visits.
On your way out, just make sure you talk to Melissa. She has all that information for you.
Okay.
Let's touch base again in a couple of months
Okay.
to make sure you're still doing okay.
Just checking in to make sure that they're taking their medication like they need to, because otherwise you can write all the prescriptions you want. If they're not taking it, it's not going to decrease your population's risk or the number of events that are going to happen to your patients.